Those who do not take the necessary steps to avoid Islamophobic and xenophobic attacks in their countries now dare to attack Turkey's right to implement its sovereign rights. We see these as attempts as a filter to separate our friends from our foes. No matter what topic, whenever Turkey compromised to come to an agreement, it was always harmful to Turkey. However, whenever Turkey stood by its principles, yes, we paid the price for it, but we never lost in the end.
That President Recep Tayyip Erdogan. Recapping the top story at this hour, South Africa is in the eye of the storm. This is the warning being sounded by the government at the onset of the peak of the COVID-19 infection in the country. While the government has stopped short of reversing the easing of lockdown restrictions, the president announced a curfew which would be implemented between 9 p.m. and 4 a.m. That's the news for now. Headlines at 7:30. It's a mostly cloudy day today with wind and rain expected. It's a 66% chance of rain. It will be accompanied by a westerly wind reaching speeds of up to 43 kilometers per hour. Temperatures should range from 8 to a high of 13 degrees.
As the moments tick by, they emerge seeking their victim. And with swift precision, strike.
At Rustenburg Pharmacy in Rondebosch Main Road, we know that the nasties can strike at any time. So we stay open until 6 p.m. 7 days a week during the lockdown. Our baby clinic is also open Monday to Saturday, so you can keep your child's essential immunizations up to date. When the nasties strike, we're here for you. Call 021 686 3997 for deliveries, orders and advice.
Rustenburg Pharmacy in Rondebosch is a member of the Vitacare Pharmacy Group.
A little sacrifice goes a long way, and trusting your Qurbani with Africa Muslims Agency not only results in you feeding the poor, but also empowers, educates and inspires those in need. Sponsor in South Africa 2,350 rands, Africa 1,350 rands, Syria, Palestine and Yemen 4,500 rands, and Afghanistan 3,000 rands per share. Call AMA now on 021 699 0545. Donate online at africamuslimsagency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
If you want to increase sales, level the competition, launch a new product, inform consumers about hot deals or services, then Radio 786 is the platform. Advertising is one of the most artistic ways of communicating and keeping your brand alive. So for fabulous deals, great service and packages designed to suit your needs, contact me, Adila Fortune, on 081 789 1094. That's 081 789 1094. Or drop me an email, adila.fortune1@gmail.com. So advertise and add the wow factor only on Radio 786.
As you walk, you smell the fresh fruit and veg, aroma of the cooked meals, and you see a world of Spar groceries. Now, I'm not talking about your mom's kitchen. I'm speaking about the experience when you walk into Spar. Spar Grooteskeer, Kromboom Quick Spa, and Ottery Quick Spa have made life so easy. From the first meal of the day to that last snack at night. Our Bean Tree coffee, bakery, deli, salad, sushi, and so much more is all you need to make a spa day. For every kind of person, there's every kind of spa. Trading hours 7 a.m. to 9 p.m., Monday to Sunday.
If you are a seeker of truth, then invest in an institution that is credible and trustworthy. We remain the voice for the oppressed and actively work to make a meaningful change. Help us to do so by contributing to Radio 786's efforts. Standard Bank, Kenilworth Branch, account number 072-890-614. Radio 786 informs, educates and uplifts.
The views that hit the news. NRA.
NRN 100.4 FM, a Monday morning, and quite a terrible cold Monday morning. I am very fearful for this child that is still missing, as we just reported, and the man that jumped in to, well, rescue her. And many members of the community have since told us that they don't quite understand the manner in which they're looking for them, because there was a big effort to look at where they fell in, which doesn't make any sense. Go and follow where the river leads to, right? Where the canal leads into, and that would be the Black River, which streams along, the golf course, and it heads then into Lisbon and then the ocean. And so they still haven't been found, and it's now day 4, I think, since they've gone missing, and it's quite. It's a tragedy. I mean, where are these kids? And I mean, where's this child and this particular man?
Yeah, indeed, it is worrying, and I think that the mother saying that she just prays that their bodies will be found, so that they can have closure, because. It is a worrying factor. Where could it have been? I didn't know those canals are that very deep.
Yeah.
Because normally when we see it, there's hardly any water in. But I know we've received quite a bit of rain, and I don't think I can really fathom the intensity of what the mother is feeling.
Yeah, because I listened to what the mother had to say. Well, I read what the mother had to say as we're reporting this morning, and she's saying that they're really just waiting now for their bodies to be found. And I think, by today, any hopes of finding this child alive is pretty grim. So, very terrible scenario, and we're keeping on that story. So, do stay tuned to Radio 786 on 100.4 FM. We're going to be talking very shortly to South Africa's National Minister of Health, Dr. Zweli Mkhize. He's going to be talking to us at the time that the President is warning us about a storm that is coming and making landfall. We're not talking about a physical storm that involves thunder, heavy clouds, and heavy gusts of wind. We're talking about an outbreak of the coronavirus that will peak to the extent that hospital wards, emergency wards, ICUs, etc. will be burdened quite heavily. We're looking at a scenario where very many more people will be infected as a result of COVID-19. And we sit currently with a scenario that the President has announced an increase in the restrictions to a certain degree, such as the wearing of face masks, including the fact that we need to not gather, for instance, as well as the sale on the prohibition around the sale of alcohol, which makes logical sense.
Yeah, I absolutely agree with the President there, and I'm very happy about that, because the kickoffs or the after effects of the alcohol being lifted, the ban on alcohol being lifted, it was extremely worrying to see what was happening. Even in your immediate neighborhood, you could see the effects of it. People, when they lifted it, the people were running in our road with what they call the papsakke, and shouting like crazy. I mean, what is that? So really, I think it is definitely for the betterment. And also, before, if you take your scarf and you wrap it over your face, that used to be a problem with the security, because they never no, I won't say all of them, but there were instances where women mentioned that they weren't allowed into the shop because they only had their scarf wrapped around their face. But now the President himself said,
wear a scarf. If it's a cloth,
scarf, like an old sweater wrapped around your face and all of that. So there we go. So,
you know what I don't understand? People that unnecessarily become fussed about wearing of something, a mask, be it a clinical mask, or be it a cloth-like mask, or be it a scarf or a t-shirt, or whatever the case may be, but covering of your mouth and your nose upon entering, for instance, a shopping center or a shop itself, it's really unbecoming, certainly, of individuals to act in this sort of way. But now, in law, the President has announced that, they would be, legislating the compulsory usage of facial masks in whatever form and shape that's going to be taking. The point is, you need to cover up. And that's one of the issues that we'll talk to the National Minister of Health, Dr. Zweli Mkhize, that's going to join us shortly. He, is one of the highest ranking members of Cabinet dealing with South Africa's response to the coronavirus, one which has been welcomed, by the United Nations as well as the WHO, the World Health Organization. And as it stands, there are some challenges in the manner in which, of course, we are dealing with this. And some of the key issues that we're hoping to touch base with the Minister, of course, would be contact tracing as well as testing. To what extent this will be still happening and taking place. We're looking at our real-time admissions and the hospitals that appear to be struggling because of the modelling that has been done. How effective can one, for instance, prepare a health system? We'll look also to the issue around treatment, whether there is sufficient oxygen, which already we are being told that in parts of Gauteng, for instance, there isn't. So prioritizing oxygen, for instance, to treat patients. The President spoke about this last night. He said by the end of this month into August, they would have procured more high-flow oxygen as well as ventilators. We'll look at dexamethasone. I know South Africa also produces, some of the pharmaceutical companies produces dexamethasone, which really is a drug, anti-inflammatory, that could assist, for instance, in patients that are on the ventilator or are in fact, in an ICU, in a high care unit, that are struggling, for instance. Dexamethasone can't just be bought over the counter and you use it. It's for patients that would need it prescribed by a medical doctor. So we'll have a look at dexamethasone as well. And something that the Minister has been talking about quite a bit, and that is Artemisia, the Villa Als that Madagascar and others have been talking about, Umhlonyane, as it is also locally referred to. We'll have a look at that coming up in a short bit. And we'll deal with how do we reconcile, for instance, a full taxi comparative to telling people, for instance, you can't visit family and so on and so forth, schools being open. All of that we'll get into with the Minister of Health. His team is telling us that they are slightly delayed this morning. It is, after all, a Monday morning, so we will try and get the Minister with us in a short bit. In the meantime, talk to us on 0786 10 11 12, our WhatsApp number. You can text or voice note to me on that number, 0786 10 11 12. It is 18 minutes now after 7 o'clock. We are due to talk to the National Minister of Health, Dr. Zweli Mkhize. Once they, of course, do become available for us, they say they are slightly delayed this morning. Assalamu alaikum, Shinaz and Tashriq. I have a little hook in front of the door with a few face masks. No forgetting when leaving the house. Have a good day. This has been one of the most challenging things. These days you have to think about your phone, cell phone, keys, as well as the face mask. And sometimes, you leave the mask in the car, you get out and, you have to turn around, I forgot my mask. So you have to just, I guess, find a way to keep it on you all the time.
Yeah, well, you have to be creative. At the end of the day, in each jacket you'll have one. Probably. But yes, keep one in the car, keep one on you, keep one at home, whatever. So you have to be creative in the ways that you do it. But I also hang it around my doorknob in my bedroom so that I don't forget it. It really stays me in the face. And I know that some people have a variety of masks, so a mask per day, which is quite good and hygienic. And to wash it every evening is a good thing to do, because you wash it with soap and water and you hang it out to dry, and just to ensure that you have a clean mask. If you don't have a clean mask for every day, then you have to at least kind of wash it every night, so that you can ensure that you have a clean mask for the next day. We women are safe because our scarf.
Yeah, it's a very convenient way to get around it.
Just wrap it around our face.
Which is what the President encouraged last night. One of the questions from the WhatsApp line that we're receiving is, where was the mother? Okay, this is concerning the child that got drowned. Where was the mother and the father? They allowed 8-year-old child to be outside. What if the child was kidnapped or something? The parent should be held accountable. Look, as an 8-year-old child, these kids are playing around and so on, and I guess going to the canal is one of the easiest ways to do so. So let me know on 0786 10 11 12. It is NRA on 100.4 FM. Tash, the lights are out in Mavis and surroundings since 3 a.m. Something must have happened in terms of the weather that would have taken the those electricity out, perhaps you'd want to report it. Long live Recep Tayyip Erdogan. Allahu Akbar, says this one, in the response to the Hagia Sophia that has now been declared a mosque once again. It was done so by the court, and Recep Tayyip Erdogan has now decided to, of course, allow for immediately starting next week Jumu'ah prayers to commence at that site. It's a very controversial matter. It was built as a church, and during the conquest of the Ottoman Empire, we saw it turned into a masjid, and with Ataturk, of course, coming into power, he declared it a heritage or museum site, which went on to become a heritage site, and it was almost seen as this remarkable historical building that had to a certain degree lots of background meaning to it, and we're going to be having a look at this later in the program this morning. Right, it's 22 minutes now after 7 o'clock. We have the Health Minister, Dr. Zweli Mkhize, on the line with us. Lovely having you with us, Minister, especially at a time when the President is warning about the storm that you also spoke about recently. What exactly is in store for us? Good morning. Good morning, Minister.
Good morning.
Thank you so very much for talking to Radio 786. It's a pleasure having you. South Africa appeared to be in the eye of the storm, as the President warned last night. Just what exactly are we predicting?
Well, we are at a point where in terms of all our predictions, the numbers of people who are infected will increase, and therefore it will cause an increase in the numbers of people who are hospitalized. And so we are at that point now. The peak was expected to come through in July and August and up to September. And so we therefore believe that at this point we're getting caught up with that increase. We have been able to delay the increase of the numbers of people infected. From the 5th of March, it delayed because we were able to do the lockdown. And out of that lockdown, we were able to then get a bit of time to deal with a number of challenges that we needed to focus on to reduce the negative impact of the epidemic. So we had to attend to the issues of the health services upgrade.
Mm-hmm. Now, Minister, the modelling from the start, appeared to be off, even the most optimistic numbers. Are you relying on any sort of modelling that will give us some insight about exactly what is in store for us?
Well, I think it's a very good point you're asking, because at the beginning, when we started, there were no models. We had to rely on the world experience, and we had to rely on our own numbers as we were dealing with them on a continuous basis. And those numbers indicated to us that the infection was rising very fast. And in that process, we ended up with a lockdown, because we thought that the increase was too fast. It was doubling every second day. And so when we reduced that, we then slowly started getting the model to come in place. Initially, they were very wide, and they were having figures that we couldn't rely upon. But with the past few months now, they've been feeding proper information. So the estimations, for example, would be that by this time, we would be at this level of over 200,000. In fact, we're going to go towards 300,000 positive cases, and that would actually increase the numbers of people who will be hospitalized. But for a long time now, we've been moving behind the numbers. But the numbers are beginning to pick up. So the predictions or the forecast varies from province to province. For example, in the Western Cape, we expected that we should have had a surge about a month or so, or 4 or 5 weeks ago, and we prepared for it, and then the numbers didn't match. They suddenly became less than what was predicted. Still going up, but nevertheless less than predicted. In Gauteng, we're expecting the peak earlier. It should have been preceding Western Cape. And for a long time, because of the very strong track and trace processes in Gauteng, the numbers delayed, which was a pretty good job that they did. But of course, once we released the lockdown from level 5, 4 to 3, then the movement of people started increasing, the mixing, and therefore the internal transmission started rising. And that's what has given us these numbers that we're seeing.
Yeah.
But what we also agreed is that there is no way you can reduce the level of infection to a point where there's not a single person who gets infected. That's why the numbers are going to continue to increase.
While you say we are certainly behind what the models have predicted, Minister, it appears, and from what we are witnessing in parts of Gauteng and elsewhere, that hospital wards are in fact at near capacity. So have we sufficiently prepared? I mean, why, if we are still behind what were the predicted numbers or what the modelling have suggested, it appears that we haven't prepared all that well?
I think from now on, we are going to be having challenges. We've been having challenges when we're dealing with the Western Cape, when their numbers started increasing. This is an issue that we have to manage every day. So, for example, in the Gauteng area, we have not breached all the beds that we've got. We have not filled up all the hospitals. But the challenge is at the point of admission, where you admit people, you have to keep some under observation so that you can confirm if they are positive or negative. Whilst they're at observation, therefore it tends to fill up because you have to kind of must have a holding area where you keep people there for a while. Once they are confirmed, they move on. So, for example, if the triage area where we separate them up is full, it means that that area is full, is waiting for confirmation of results, is waiting for certain observations, but the beds are still open. So in Nasrec, with over 500 beds, we haven't used over 100 of those beds, and we're trying now to increase. So with time, we will get that matched up. And we also have said the province must create what we call a kind of bed administration bureau. So if anybody comes by ambulance, they don't need to go to the nearest hospital. They need to go to the area where the beds are available. And so that can be done as an administrative issue. So that is also being put in place in a number of areas. It was very helpful in the Western Cape to do that. And so we're doing all of those kinds of things. Now, on a day-to-day basis, the numbers of beds that we have, we predict that there will be an increase. And so the models do show that if we don't increase the beds now, there will be more people, there will be more beds needed than what we have available. And so we've recommissioned for additional beds to be done. They will be available in time for the numbers to be accommodated. So the other thing which we have learned in this pandemic is that it's one thing to do a plan, it's another one to handle the pandemic. So at the beginning, when we started, we had enough experience and so on, but we didn't get a sense of the numbers and where this pandemic is going to be showing up. So we had to now follow the pattern of the pandemic to shift your resources to where the pressure is.
We're talking to the Health Minister, Dr. Zweli Mkhize, here on NRA on Radio 786. Minister, what sort of integrity do we attach here to the numbers in the Western Cape? Now, the Western Cape, yes, has seen a surge, if you take it against the backdrop of other provinces, but the testing criteria, for instance, has changed in the Western Cape. We then, by last week, started hearing that the numbers are stabilizing. These are from recorded positive infections that go to laboratories. Can we really make that conclusion when the testing criteria, for instance, has changed in the Western Cape? And by addition to that, I'd like to ascertain whether you could see a similar approach for Gauteng and the Eastern Cape as well.
There is no special criteria for Western Cape that doesn't apply in other provinces. Sometimes when they talk about their provinces, each provinces will talk about themselves in a way that makes you think that is very different. Let me just say, at the beginning, when we were doing the testing during the lockdown, we sent people all out to go into the community where there were cases spotted. We went and screened communities and tested them. Now, this was happening throughout the whole country. And over a period, those numbers increased to such an extent that with the shortage of the kits, we started experiencing backlogs. But then when we started moving from level 4 to level 5 to level 4 to level 3, we then changed the approach to say, we know now where the pressure is of the infection. So there are low transmission area, there are high transmission areas, which we call hotspots. And therefore, because we need, the numbers are increasing, we need a special focus which reduces the turnaround time of the test, so that there's easy management of the patients and finding of contacts, especially, as well as the of staff. So we then said that the criteria must change. It must focus on those who are presenting in the hospitals and those whom are prioritized. So that was agreed. Now, this is happening in the whole country. The numbers are reliable. Let me also put one other point, and the point is that we, at this point, can talk about positive cases. It doesn't necessarily mean that the whole country has only got those people, because there are many people who could be positive for COVID-19 but have no symptoms, in which case you won't know who they are. But the numbers are pretty reliable. The criteria are the same. What was delaying was the backlog that was delaying the release of the results. We've cleaned that up, and in Gauteng we're also cleaning it up as well.
So, Minister, if I am a 30-year-old that appear to be not feeling well, can I walk into a public health facility and get a test and not be told that I'm not at the age of 55, I don't have comorbidities, so I am unable to get a test? Can I still get a test from a public health care institution?
The test is prescribed by the doctor on the basis of examining the person. So the person must have something that makes the doctor feel that they must be tested. So there have to be symptoms, there has to be exposure, and that's what will give the doctor a sense as to who gets to be tested. So you could be any age, but if you've got symptoms that require you to be tested, that really takes you into testing. There is a lot of people who we call the worried well. Basically, you just sit and get worried that you might be having the infection, and then you ask for a test. It may not be possible to get that test, whether you go to the public or private doctors. It's a matter of the doctor having convinced himself that you need the test.
Yeah. Dr. Zweli Mkhize, the Minister of Health, on the line with us. Minister, the President last night stopped short of reversing the easing up of some of the restrictions. He did, though, announce a curfew. He announced the prohibition around the sale of alcohol. Previously, the government warned that where there are hotspots, we could see an upscaling of the alert levels under the lockdown restrictions. That has not happened. And there appear to be, from some South Africans, a critique for this particular approach, because while, for instance, I'm being told I can't visit my family, government feels it's okay, for instance, to travel in a taxi that is at 100 capacity. School children are allowed to go back to school. There appear to be, without being unnecessarily flippant about it, there appear to be an inconsistency in these different approaches.
Well, I don't think we can avoid inconsistencies here. I think what we really do is trying to do our best to contain a very, very problematic pandemic. And therefore, if anyone finds that there's a fault in this or that and the other, we will look at that. I don't think we must expect something perfect here. And I don't think if today we announce something, then we change it tomorrow, we should be, worrying about inconsistency. We have to just go by what we think is going to help at that point. And every country is battling in the same way as we do. So what happens here in this case is that to start off with, when we did the lockdown, the biggest problem that we're worried about is food security, and income security. So people do have to get food, they must have income, and to do that, we therefore need to have to balance the opening up of economic activity, at the same time trying to contain the infection, because the numbers of people who have lost jobs, who are going without food, is very high, and therefore whatever support government would have given on social grants is not enough to be able to cater for everybody out there. So we have to try and balance the two, lives and livelihoods. And so that's what we've been doing. Now, to get those livelihoods, you need people to move, to go from their homes to a place of work. And in so doing, you have to therefore find ways of how to mitigate against the spread of the infection. And so we have therefore set down the best way of stopping this virus is to lock everybody in their homes, and no one must move out. Mustn't talk to touch other people, mustn't meet with other people. But that's not how life works. This infection is going to be with us for this year and the next year as well. So we have to start adjusting how we can live within the context of this infection. So the inconsistency here is that we need people to go to work, and when they go to work, we need to try and reduce the rate of spread of the infection. So we had a lot of debate with our ministerial advisory committee, with all the experts, the scientists, and said, what is the best way? Now, there is a level at which if you were to keep the taxis at a low level of occupancy, those taxis will not be able to run because basically to pour petrol, they need to have some revenue. To pay the debts, they need some revenue. If you have to balance that, you know that there is a number of passengers which has been objectively assessed.
Sorry, I don't want to be unnecessarily flippant about this, right? And I understand the need for economic activity, and I understand the need to balance the two. I'm by no means a proponent for keeping the country under lockdown forever. But there are very many other sectors that have had to compromise. If, for a taxi industry to hold government almost to ransom, to force government to say, keep it at 100% capacity at a time when health professionals are warning, that, in confined spaces where there's lack of ventilation, you may have an increased spread of the virus. On a morning like this in Cape Town where it's cold, it's wet, how do you possibly allow a taxi to run at full capacity, at schools to resume at the level that some wanted? I know I don't want you to be clashing here with your counterparts in cabinet, but on all accounts, from what you're saying from a health perspective and what's being done on a practical perspective in terms of reopening up of the economy, it just doesn't make any sense.
No, well, look, let me say that the taxis. The ideal would be to get less than half the people in the taxi, but that does not work in real life. And so the wearing of masks, you see, when we say it's mandatory, nobody's going to go into a taxi without a mask, and that the taxi operator must take responsibility for that. It's a very strong rule, that. And secondly, everybody must sanitize before they go in. And then there's a certain amount of opening of windows, which in terms of the scientific understanding, it's going to allow the flow of movement of whatever aerosol that is in the vehicle, so that it moves out. There's been experiments that have been shown to show how long to keep the droplets, and what happens if you've got a closed space, what happens if you've got a draft of air that moves the aerosols so that the concentration is not so high. So there's a whole lot of that work that's gone behind it. So it's not just a matter of I think what causes people to concern is that the taxis were, very belligerent in the way they express their thing. But we sat down and analyzed this thing beyond the strong words and so on, and we told the taxis that they are not going to work like that. But we went through with the scientific teams to say, if we have these challenges, how do we manage it? It's a best compromise that we've got. We think that it does mitigate against the spread of the infection. And when it's longer distance, we then, of course, insist on opening up because of the longer exposure. So it's also a compromise either way. All the things that we're doing is to try and manage everything together. And I don't think that is being flippant about it. It is correct to discuss it properly, like you're asking.
Yeah. Minister, I know you're pressed for time and have to go, but I have two quick questions. I just want to talk about the treatment, that is being considered at the moment. Yes, there is no vaccine, and the research continues in that respect. South Africa is also part of the international effort to try and find a vaccine for this virus. But let's focus in the meantime on treatment. I, for instance, have been taking my lemon water and so on and so forth, and garlic, and as a way to boost my immune system. South Africa at the moment is talking about Artemisia, the Villa Als or Umhlonyane, as a way within which to consider treatment of this virus. Where do you stand on this, and do you think that in the interim it is worthy of an approach, certainly, to consider the use of Umhlonyane and others, as a way to build up your immune system against the symptoms of this virus?
Well, there are many things which we have used, from our own traditions, the garlic, the Umhlonyane, and so on. We've used Umhlonyane for years. When we grew up, there was no hospital treatment for flus and colds and so on. We used Umhlonyane, we used Munyane, we used Nsukumbili, we used those, kind of things. So people know these things that have been used in the past and that have been useful. And so there's nothing wrong with those. If you know it and you are comfortable with it, then of course we've got no problem with anybody using that. Insofar as this Artemisia from Madagascar, the government did approach us to say they would like to be assisted to verify its effectiveness. We agreed, and then in the process, the matter was taken up by the Africa Center for Disease Control, who are going to work with Madagascar, and therefore they'll approach any of the institutions to assist them in that process. So that work is going on. Now, so far as the prevention, it's, everybody out there who has a remedy that they know they can use, that it works, and so on, it's fine. But it doesn't mean that we've got scientific evidence for it. It just means that we've known that we've used it, and we think that it's going to help. And if anything, it's going to help to boost your immunity, or it makes you feel that you're doing something for yourself. That's okay, as long as it's not dangerous.
Yeah. And lastly, Minister, we've become fatigued around sometimes the washing of hands, the wearing of the mask. There are some people that take the approach to say they don't want to wear the mask at all, right? And the President spoke about, in regulation, publishing those that will now make it, a criteria, or at least it necessitates the wearing of the mask, for instance. But there's also a degree of mistrust. It would be remiss of me to say that there are people that, if they're not blaming 5G, they are saying that this is a conspiracy, and so on and so forth. So you deal with people that are fatigued around what is required of them to stay healthy and protect especially the elderly. Then you get those that are completely in denial about it. How do you, what do you have to say to them? Because somebody that's at the cold front of South Africa's strategy to try and mitigate, the further harm of this virus, what do you have to say to those people?
You're absolutely correct. Firstly, there's a lot of denial where people don't believe this thing is true. And when it does, until it hits very close to them, then they get a bit of a shock that this is real. So many of the people will be convinced as we move on, either because we've got increasing amount of information and people are seeing it, and that more important is person-to-person talks. When people in the community, in the families, begin to encourage each other to say, look, we have to wash your hands, you have to wear your mask, and in the community, in a taxi, in the workplace, at school, and everywhere. When people talk about it, that's how you begin to get a new culture to set in. And so we believe that it's something that we must just be patient, must keep insisting on people having to take those precautions. The cynicism will always be there. Some people will pick up a story and then run around with fake news and so on. Those things you can't avoid. We must just ensure that we keep pushing so that people ultimately understand the reality. It's one thing to hear about COVID-19 in Wuhan, in China. It's another when you start seeing the impact in Italy, in America, and so on. But when it hits South Africa and you begin to know people who are infected, people who have passed and people who are sick and all of that, it does change behavior. So we must just be patient, but we need to say to people, COVID-19 is real. It's here in South Africa. It's going to affect anybody, and everybody can actually be exposed to it. And that, we're going to lose our loved ones. We're going to be affected. But all of us can actually reduce the impact of the COVID-19 by ensuring that we use our masks, we will wash our hands and sanitize. We must never get tired of it, and we need to create this culture. Most of the children who are growing up now will grow up with that as a normal culture. But those who are at the point of transition might be doubtful, but with time, we'll all be able to realize that there is a way we can survive this. And we want to encourage everyone to be, to trust the messages we have to pass through. And that's why we always want to make sure that it's the president who speaks, it's the ministers who speaks. And in the process is to make sure everyone out there must know this COVID-19 is real. It can be defeated, but we need to work together. We need to unite, and we need to follow the new ways of living with the virus.
South Africa's Minister of Health, Dr. Zweli Mkhize, thank you so very much for your time. Speaking there to Radio 786 almost exclusively after the President ramped up South Africa's efforts to control the spread of the virus is Dr. Zweli Mkhize. We have been told by the President that the wearing of the mask is now compulsory. We have also been subsequently been alerted to the fact that it's been now gazetted and regulated that, as of tonight, a curfew will come into place starting 9 o'clock until 5 a.m. in and amongst a range of other measures. And the minister there speaking to Radio 786 around South Africa's efforts to try and mitigate what certainly is the storm that the Minister of Health and the President is warning about. It is now 14 minutes before 8 o'clock in our AN1.